Welcome, everybody. On behalf of the North American Spinal Cord Injury Consortium, I want to welcome you to our quarterly webinar series called SCI Connections. Today's we're going to focus on the COVID-19 vaccines, and really looking at different perspectives on how to administer it, how to get it, some of the concerns we have about it, and the general education to our community. I just wanted to really introduce to us the North American SCI Consortium. We are an organization that is bringing together all aspects of spinal cord injury in our community throughout all of North America. We are trying to connect all of us together, and that's why we have this webinar series to begin with. But it's a great opportunity to share perspectives, strategies, and really share ideas that connect all of us together, and how we together as a community can be stronger as we join together. And I really wanted to invite you all, and Jess, the next page, to really become a member of the North American SCI Consortium. And you can do that by seeing the website down here, nascaconsortium.org, and then it's /membership. And next slide. That really gives you an opportunity to learn more about our organization, and frankly, be part of it and be part of a greater good and sharing our ideas. We believe there's strength in numbers, and this is really the first time that us as a community have really joined together this way. There are 3 levels of membership that we offer at our North American SCI Consortium. One is a patron member, which really deals with individuals who are either people with lived experience, consumers with SCI, or caregivers. Then there's a principal member, which are organizations like United Spinal, for example, where they can join. And these are normally 501c3 or charitable organizations. And then we have partner memberships, which is really all other stakeholders in the field of SCI. So that could be institutes, various levels of learning, as well as private sector, which could include pharmaceutical companies, for example. All 3 members levels are really welcome to our organization, but it's important that we let you know about this. And I can't urge you enough to, if you're not a member, to please join or have your organization join. It's free. It doesn't take long to do, but by doing that, it gives us more strength in numbers and a better opportunity to share resources. We believe that we can do this through collaboration, connection, and make those changes that come with it. So this is very important for us. And I just wanted to give us our little shout out to who we are and what we do. And again, that information will be available. Jess will put up the web link in the chat room that you'll be able to see and throughout this webinar series. Next slide. So again, I want to welcome you today to our presentation. We have some 3 really great speakers, and I want to thank you in advance for allowing us to be part of the work that you do, and giving us the opportunity to share your great work and your message with our organizations and the membership that's going to be on today. I just want to let everybody know that this presentation will be archived on our website. So if you can't see the whole thing, or you wanted to make sure somebody saw it after today, it will be there, along with many other resources that we have up in a section of our website, all dedicated to COVID-19, which is addressed. We try to make as many resources available. And we are attempting now to do much of these resources in Spanish for our Spanish listeners and followers. And soon we will be approaching our French listeners and followers, and try to convert as much resources that way too. So today's agenda, we're going to have a discussion on presentation by Dr. James Milligan. And you'll see he's going to talk about the vaccination with SCI and his view from a primary care physician. Then we'll have Linda Mastrandrea, who is going to then speak to the vaccine and equitable access through FEMA and her organization. And then we'll have Dr. Lisa Wiggins make a presentation on the vaccine information and resources for people with disabilities through her work in the CDC. And afterwards, we will have a panel discussion, which we will invite Q&A. Questions and answers will be provided at that time. My name is Barry Monroe. I am a director and treasurer of the North American SCI Consortium, and I will be your moderator today. I would like everybody that's listening today to hold your questions, if you could, until the end of the 3 presentations, because frankly, some of the information that you're looking for might come out of one of the presentations. But by all means, put your hand up. We will invite questions. And then throughout the day, if you want, please, if you can, put your questions or comments in the chat room. And Jessica, by the way, this is Jessica, the right hand and the one in charge of you always got to be careful. The one in charge of the presentation is the most dangerous person in the room, I always feel, but that's fine. She does a great job, and she will be there to help really go through the questions and see if we can get to everybody that have asked questions, and we get as many answers as we can. This is about information. You have a chance here today to ask 3 really great experts in this area and bring about the difference perspective. And as you'll see, we are the North American SCI Consortium, so there's going to be, I would say, much more of a local version of coming from Dr. James Milligan, being a frontline primary caregiver in Ontario, Canada. And then, of course, the other 2 presentations will be much a larger national scope from both the CDC and FEMA. And they will, I think that perspective brings a different light to things, but you'll also hear some universal answers to some universal questions that we all have with regards to the vaccine and COVID-19. So I've talked enough, and that's the most you're going to hear from me today, I hope. And I just wanted to now introduce Dr. James Milligan. Dr. Milligan, our first presenter, is a family physician who has completed additional training in academic family medicine. He established and leads the Center for Family Medicine Mobility Clinic, which provides individuals with mobility challenges access to an interdisciplinary care team and a clinic tailored to their needs. As a Schlegel specialist in mobility and falls, Dr. Milligan establishes collaborations between primary care and long-term care to advance practice and research related to mobility issues. He investigates ways to increase access to exercise, mobility, and falls prevention programs for older adults living in the community in retirement or long-term care. Dr. Milligan is also working to enhance education about mobility issues so that health professionals can provide better care, resulting in improved quality of life for older adults. So without further ado, Dr. James Milligan.
Okay, thanks so much, Barry. And I just want to say thank you for inviting me to speak. This is obviously a great topic, and I think probably there's lots of questions, and hopefully it stimulates some dialogue. So Jess, if you just move forward. These are just a few objectives in the 10 minutes or so that I have that I just want to kind of cover. I want to just reiterate, I'm going to speak fairly generally, but then also really speaking from in parts from a kind of a narrow lens in terms of being in Ontario, Canada, and just understanding that there's lots of things that are probably similar across Canada, North America, the world in terms of how things are being dealt with from a vaccine perspective. But there's also a lot of nuances, even when we just look at regional types of things. So, I'll probably hit on a bit of that as well. So Jess, if you go ahead to the next one. So I like to start with something kind of positive. We've had a year of, just a lot of negativity, of course, but we're seeing things get better, and we're seeing positive messaging start to occur. And this vaccine has obviously been sort of, at the forefront of that. So a recent poll here in Canada suggests that a lot more people compared to September of 2020 are really interested in getting the vaccine as soon as it comes out. And there's a lot more that will not wait. We still have a small percentage of people, like 12%, it mentions there at the bottom, that probably won't get the vaccine at all. I mean, we're always going to have people who have different views on things, but I think this slide really points to the fact that it's really starting to gain some momentum from even September in terms of the acceptability. And I think that really speaks a lot to all the positive messaging and the work of so many people out there. But having said that, we still have a lot to work on. And, and from a practical sense, I really see this kind of occurring as well. As a family physician, I've worked in the outpatient COVID assessment clinics from, the start of the pandemic, April, May type of thing, where we were seeing people who were ill, we were doing swabs, and of course, nobody was happy to see us at that point or be in our clinic. And now we've transitioned to where we're giving immunizations. I'm a part of those clinics. And the difference in the attitudes, of course, as you can imagine, is just unbelievable. I mean, people are so happy to get vaccinated. It's such a, almost a joyful thing. So it's really a nice thing to see. So just go on to the next slide there. But, having said that, there's still like a lot of, confusion out there. We're getting bombarded with different news, um, news breaks every day, this is good, this isn't, this causes this, all kinds of stuff. And that in itself is just creating confusion, not only for individuals, but also for, clinicians and everybody. And then I think when we start looking at our really more vulnerable populations like spinal cord injury and spinal cord disease, we add in, I mean, it makes it harder, of course, but we add in also the known barriers that always affect this population, and that would be things such as physical barriers and just access to healthcare sometimes. So we know we've got more work to do with our population here. Jess, go ahead there. So I just really did a quick look at sort of what has been the historical view or sort of uptake of vaccine in the spinal cord injury community. And as can be imagined, it's often not as high as the general population. So there's been numerous studies that have demonstrated that, and we did a study ourselves that have shown that influenza and pneumococcal or pneumonia vaccine is often not near the rates of that of the general population. And there's a few reasons for that. It's not entirely physical barrier and access to care issues. It's often related to a misunderstanding about the vaccine and not knowing that it may be recommended for individuals with spinal cord injury, and also their healthcare providers not necessarily advocating it for it like they should. For example, we'll often recommend that it's a really good idea to get a pneumococcal or pneumonia vaccine under the typical general population guidelines, especially for people who have problems with their lungs as a result of spinal cord injury. But that's not always communicated to people. The individuals don't always know that. So in other words, we don't do a good job, and many of the individuals don't get vaccinated at the same rates that they could. Despite the fact that, as mentioned here, there's a 37 times increase in death, possibly from respiratory complications from things like the flu and pneumonia. Now, we can't extrapolate the flu and pneumonia studies the same way. COVID is a different beast altogether, and the amount of, messaging and everything that's occurred with it make it, a totally different thing. But I think this is important to take stock of when we start looking at vulnerable populations and start trying to say, where are the holes in the things that we're doing and where do we need to tailor some efforts. The last little statement here as well says that the other thing is that there's lower rates of vaccinations in healthcare workers providing services to these populations often. And we've seen that, and we've seen that within the COVID vaccination programs as well, is that oftentimes the healthcare workers, for a lot of reasons, there can be a lower vaccine uptake, and maybe we'll talk about that a little bit later. Just next slide there. Oh, and go on to the next one, just that's a copy actually. Okay, so one of the things that we can do, all of us can do, but especially in primary care, public health, other allied healthcare professionals, a really big role is that we have to role model this stuff. We have to be the ones to get that message out there, get rid of some of the myths. That's why this webinar today is a great idea. And really just get some confidence out there, answer questions and give some support. And that's a huge role, not to be underestimated. Okay, next one, Jess. So I just threw this slide up. This has got a ton of stuff on it, but this is just talking locally about the Ontario vaccine rollout. And when we talk about Canada in general, probably to the US, our vaccine rollout, I would think has been much slower. We started vaccinating mainly December, and our phase 1, which you'll see on the left, really focused on long-term care residents and staff. That was the majority of that, and then getting into other healthcare workers and hospitals and that type of thing. And now we've just moved on to phase 2 as of the beginning of March. So that's probably well behind what the US has done. And I think they've done much more mass immunizations. So now we're into mass immunizations in phase 2. We just opened a clinic right next door to me right now that I do some work at, that just started this week doing some mass immunizations. And that's an exciting thing. This is where we start getting more into the the spinal cord injured population. So Jess, if you just click the mouse once there. So where the spinal cord injured, oh, okay, well, that's okay. Don't, thanks. So where the spinal cord injured population and others with some physical disabilities have fall into this map, in phase 1, they were able to get immunized if they received chronic home care. So there was a bit of an avenue to kind of get in there after long-term care and those workers. So there's a few that have been immunized there. And then if you click again, Jess, it's mainly, when phase 2 opened, it was mainly looking at 80+ years old, but there's also now starting to open up to individuals with these arrows here of high risk conditions. So that's another avenue to get into, and we're starting that now. And just if you click on one more time, and also those with, and their caregivers as well. And just click one more time, Jess, and then I think we may have missed part of this slide, or well, maybe it doesn't show here. Where the blue arrows, it's not showing on my side of things here, but where I highlighted in the blue areas actually talks about mobile vaccination. So we're in the process of developing mobile teams that will go out to those people who are more housebound and can't be immunized. That's a super important strategy. And yesterday, the Ontario government announced $4 million towards that kind of a project for those with physical disabilities. So that's awesome. Okay, next slide there, Jess. All right, so in primary care, and when I say primary care, I mean everybody who's involved in the community. I don't mean just family doctors. We need to lead by example. This is the, a huge role, as I mentioned, get the vaccine, tell others that, this is an important thing. Advise the patients to get it. And be an educator. From our perspective, we've done a lot of preemptive education, knowing this vaccine's coming. We haven't been just waiting for it to come. We've actually been reaching out to vulnerable populations and asking them their thoughts and trying to prepare them for things. Next slide there, Jess. We've also been involved in our area in leading the vaccine delivery. So as mentioned, we just opened up a mass vaccination clinic next door. The turnout in terms of family doctors and nurse practitioners who've volunteered to be immunizers or help oversee the clinic, and other volunteers to help guide patients has been astronomical. It's just really heartening to see that. And we have to make sure within this, though, that we're reaching out to a vulnerable population. So our mass immunization clinic is fully accessible. It has some extra rooms where we can take in people that, have some mobility challenges. But, we also, as mentioned, have to reach out to people and help some of these people get registered, because all this occurs on the computer. You have to pre-register. So we have to help people with that and be active with it. And Jess, I think one more slide here. Yeah, so we've done some within our records. Primary care is really important for this. Probably nobody knows the patients or our patients better than us. So in order for public health to try to identify vulnerable populations like spinal cord injury, they will lean on primary care to do searches in our electronic medical records to find those individuals so that we don't lose them. And that's what we're in the process of doing as well. And go ahead, Jess. Okay, so in summary, so the vaccine rollout's underway. That's positive, but it's really heterogeneous. This is so different everywhere. There's a lot of messages. There's a lot of disinformation. There are some barriers, and vulnerable populations always tend to be at risk of being left behind. I've been really encouraged about how this has been developed so far, and the kind of thinking that's gone into servicing individuals with physical disabilities. So I'm encouraged by that, but we still need to be proactive in getting the message out there. And just last slide there, Jess. Good. So thank you so much. I really appreciate it. And I'm, of course, will answer any other questions a bit later there.
Thank you, Dr. Milligan. It was a great presentation. And I do encourage people to think about possible questions that they'd want to ask a frontline primary caregiver to really get into his head, if you could. I've had several conversations with Dr. Milligan, and it was very enlightening learning about, more anecdotally, about our population and how we're approaching the vaccine. And as I stated earlier, that you're going to hear some things that are somewhat local or some things that are really generic across, frankly, North America and how the vaccine is being rolled out. And I just want to encourage people to keep an open mind and listen to some great strategies that might come out of today's discussion. So with that said, our next speaker, I'm very pleased to welcome Linda Massandria, who serves as the FEMA Director of the Office of Disability Integration and Coordination. Ms. Massandria has spent the majority of her career as an attorney, concentrating her practice in disability law and civil rights, and has lectured on the Americans with Disabilities Act and other disabilities laws nationwide, and also represented the United States 7 times in wheelchair track in international competition, and is the first female Paralympian inducted into both the Chicagoland Sports Hall of Fame and the National Italian American Sports Hall of Fame. So thank you for joining us today, Ms. Andrea, and welcome to our webinar, and we look forward to your comments and your presentation. Thank you.
Thank you so much. Really appreciate the opportunity to be here today. So we can go to the next slide. So as you heard, my name is Linda Massandria, and I am the Director of FEMA's Office of Disability Integration and Coordination. And I'd like to thank the North American Spinal Cord Injury Consortium for having me here today, especially Barry and Jennifer, who facilitated the introduction. And thanks to everyone who's with us today for spending some time with us this afternoon. Next slide. So today I'm going to share with you a little bit of the history of FEMA's Office of Disability Integration and Coordination. And you'll hear me refer to it sometimes as ODIC. At FEMA, we live in acronym land quite a bit. But I'm going to tell you a little bit about what we do, why we do it, and how we do it. And I think that's important to set the stage to talk about the COVID vaccine rollout and how we're involved in that. I'll then talk about how our office is supporting the COVID-19 vaccination centers across the United States, and how we're honoring FEMA's commitment to ensure equitable access for people with disabilities in the vaccine rollout. You can go to the next slide. So disability integration as a concept didn't always exist in FEMA, and it wasn't really until after Hurricane Katrina in 2005 that emergency managers realized that they needed to do better when it came to people with disabilities. And so a law was passed called the Post-Katrina Emergency Management Reform Act, or PCEMRA, again, living in acronym land. And that law created a disability coordinator position in FEMA. And that disability coordinator advises the FEMA administrator on issues relating to people with disabilities who are impacted by disasters before, during, and after disasters. And so in recognition over time that this was a pretty tall order for one person to deal with across the nation, the Office of Disability Integration and Coordination was created to support that position in serving people with disabilities impacted by disasters. Next slide. So the mission of our office, as you can see here, is to help people with disabilities before, during, and after disasters. Pretty simple, but a relatively tall order. But we accomplish this through a couple of different ways. Through our work at headquarters, through our work across FEMA's 10 federal regions, and then in the field during active disasters. Next slide, please. So our priorities are working with FEMA across all of our programs to design programs, services, policies, and procedures proactively to integrate the needs of people with disabilities on the front end across all phases of emergency management, response, recovery, preparedness, and mitigation, to ensure that the needs of people with disabilities are met across the range of programs and services. And we want to do this on the front end to avoid having to react to barriers that crop up later. Not that they don't, and we can certainly address them, but by being proactive, we reduce the amount of that kind of work that we have to do. We also work to build capacity across the agency with our state and local and tribal and territorial partners, and with non-governmental organizations and disability advocacy organizations, to enable them to better serve people with disabilities as well, because that's really important. No one organization or entity can do this by itself. It's really about partnership. It's really about working together as to how we can most effectively serve people with disabilities who've been impacted by disasters. Next slide, please. And so I'll just kind of briefly headline for you how we do our work at headquarters in the regions and in the field. So at our headquarters in Washington, D.C., the Office of Disability Integration and Coordination works with the other FEMA programs to, again, ensure that as we're designing and implementing new programs, policies, and procedures, that we're integrating the needs of people with disabilities from the beginning, hence the name of my office, right? And we offer technical assistance and advice on how to integrate the needs of people with disabilities into the programs and services to enable these programs to better serve people with disabilities. So we don't want to do the work of the programs for them. We want to help them serve people with disabilities better. So we are really trusted advisors to all the FEMA programs and services. And we staff what's called the National Response Coordination Center, or NRCC. And this is the nerve center, if you will, of disaster response during federally declared disasters in the United States. And that's where everything happens. And this is where the COVID-19 response and the vaccine center rollout is happening right now. And the interesting thing, though, for as busy as we are at headquarters and the work that my staff of 15 does there, our work doesn't stop there, right? Disability integration is really a big job if you're going to do it right across the nation. So our office plays a really vital role across the 10 FEMA federal regions as well. During disasters, we have regional disability integration specialists, one in each federal region, and they serve as a liaison between their region and headquarters to make sure that people with disabilities get access to the programs and services they need. And they really, the regional disability integration specialist is the person with the ears to the ground. They're forming the relationships with disability organizations across their region and the communities, and working to make sure that as the disaster is unfolding and the response and recovery are happening, that the leadership have the intelligence and advice they need to effectively respond. And when they're not responding to a disaster, then the regional disability integration specialists still keep busy. They're basically working on engaging with emergency managers, disability organizations, and our other partners too, at the state and local and territorial and tribal levels, educating people on personal preparedness, educating emergency managers on how to meet the needs of people with disabilities before, during, and after disasters. We've discovered that there certainly isn't anybody out there who doesn't want to do the right thing. It's not that they don't want to help people with disabilities. Often they don't have the tools, they don't have the knowledge, they don't have the resources. That is the gap that we help to fill, both through headquarters and through the regions, to help bring that capacity up. And the really important piece too that the regional disability integration specialists take part in is connecting emergency managers with the local disability organizations so that they can both work together more effectively to serve the needs of people with disabilities in their communities, right? And they're working together and engaged and planning and preparing and exercising and training well before disaster happens. So they know who to call on and what services and assistance they can provide each other. So that's a really important piece of what the regional disability integration specialist does. But again, our work doesn't stop there. So we have work at headquarters, in the regions, and then in the field. So what that means is during active disasters, we'll have disability integration advisors who are deployed to that disaster. Again, and they are on the ground to provide guidance and technical assistance and advice to the field leadership as they respond to active disasters to ensure that the needs of people with disabilities who are impacted by that disaster are met. So those disability integration advisors will work with the regional disability integration specialist to get intelligence on the needs of people with disabilities. Is there a significant population of people with spinal cord injury living there? Is there a significant number of assisted living facilities or group homes, or is there a big deaf population, right? Getting that intelligence so that they can effectively plan and provide better service. So that's a really important thing that the disability integration advisors do. Next slide. So if that wasn't enough, right? We do work at headquarters in the regions and the field. Now, the Office of Disability Integration and Coordination has an active presence in the COVID response and vaccine center implementation. So FEMA basically took on a very active role in the COVID response just about a year ago. And my office has played an integral part in making sure that people with disabilities have access to the COVID vaccine rollout. So our disability integration advisors are working on this across the nation. They're staffing some of the vaccine centers, providing advice and guidance, making sure people with disabilities have the access that they need. And, you know, some interesting facts about our program. Just this January, President Biden deployed FEMA to meet the goal of 100 million doses of COVID-19 vaccines to be administered within the first 100 days of his administration. And FEMA, of course, again, like I mentioned earlier, no one can do this alone. So FEMA can't do it ourselves. We began working with our other federal interagency partners to coordinate with our state, tribal, and territorial partners and to assist and augment and supplement, you know, the vaccine effort across the United States. And so as of March 19th, FEMA and our federal partners have supported President Biden's goal of administering 100 million vaccinations, and we met that goal 42 days ahead of time. So that's pretty impressive. As we know, this pandemic has gripped the country and the world for over a year now. FEMA is working day and night with our partners to bring the COVID-19 vaccine to communities around the nation, establish vaccine centers, accelerating statewide efforts, and supporting people with disabilities in every community. Next slide. So let's kind of switch gears. I've kind of laid the foundation for you and talked about my office, what we do, why we do it, how we do it, and given you a little taste of our overall efforts as it relates to the COVID-19 vaccine. But now I'd like to spend some time talking specifically about FEMA's efforts to provide people with disabilities access to the vaccine. You know, we recognize, as Dr. Milligan talked about, that people with disabilities, including folks with spinal cord injuries, may be at higher risk because of their disability, because of underlying conditions and other factors, right? And we know that people with spinal cord injuries may experience more severe symptoms if they develop COVID-19. Other people with disabilities, same situation. We have some different risk factors that are at play, right? And so we want to make sure that people living with spinal cord injury and others with disabilities who want to get a vaccine are able to do so. It's really important. And FEMA is really committed to the equitable distribution of vaccines, right? Making sure that people with disabilities, people of color, people with limited English capacity, people across a range of ethnicities and everything else and cultures have access to their vaccine, right? That's really important. And so it's, as you can imagine, it's kind of a multifaceted thing to make sure that all of these communities and individuals can have access and you know, effective access, right? And so one of the things that we're really focused on is making sure that people with disabilities who choose to get vaccinated have access in their communities. And we've used data from the CDC's Social Vulnerability Index and the census, and we've used some of that data to work with our state partners to try to locate the community vaccination centers where they'll be able to do the most good and target the people who really need to have that access, right? And we're continuing on a daily basis to stand up and provide support to the vaccine centers around the nation, again, with the operations that are coordinated out of our NRCC, or National Response Coordination Center. And the challenge for us, you know, is that each state determines its own vaccination priority and procedures. And, you know, you heard Dr. Milligan talking about how it's working in Ontario. And now, you know, we have sort of 50 states doing 50 things across the United States. So we try to provide some advice and guidance on how to do that in an equitable way, right? And in particular through my office, how best to serve people with disabilities, you know, through this effort, and, you know, as part of our efforts on providing equity. And, you know, one good example of this is how disability organizations around the United States have hosted events in their communities to facilitate vaccinations for people with disabilities. And these are often reflections of that thing that I mentioned, this need to work together, and community level partnerships that our regional disability integration specialists are kind of cultivating year in and year out. And working with our state partners to make sure that people with disabilities can register for and to receive their vaccine with the same ease as anyone else, right? Our disability integration advisors, as I mentioned, are deployed to the vaccine centers, and they facilitate reasonable accommodations for anyone who needs them. And we have civil rights advisors on the ground to help ensure that our civil rights checklist guides the site selection and stand-up process to make sure that physical access, is a priority as well. So that's really important. And, Dr. Milligan also mentioned mobile vaccination centers, and this is just like in Canada and in Ontario, it's a really important piece of the plan across the United States to make sure that for people who can't get to a vaccine site, whether because of lack of transportation, because they can't get out of bed, or they can't leave the home because of their disability, whatever the unique situation may be, that we can bring the vaccine to them. And you'll see efforts like this really building up around the country to facilitate that effort, right? And you can learn more about this and the entire vaccine community rollout at FEMA.gov. And that will provide you with all kinds of resources about what we're doing in the US. And, we know that you may have questions and concerns about accessibility of sites, prioritization for people with disabilities in the rollout. And, as we work with our partners across the federal interagency, across the states, we want to make sure that people with disabilities' voices are heard, that their concerns are addressed, and that we are most effectively serving the needs of people with disabilities who want to get the vaccine. And so that's why we're really pleased to be here today, to be sharing with all of you. And I'm really looking forward to taking your questions and to giving you some information on how best to take advantage of the vaccine program should you desire to do so. So thank you very much for having me here today, and back to you, Barry.
Thank you, Linda. That was an excellent presentation. There's so much going on, and we look forward to learning a bit more, maybe through the questions as well. So for our next speaker is Dr. Lisa Wiggins. Dr. Lisa Wiggins is a behavioral scientist and with the National Center on Birth Defects and Developmental Disabilities at the Centers for Disease Control and Prevention, CDC. She is currently deployed as the Disabilities Unit Lead with the CDC Vaccine Task Force. In that role, Dr. Wiggins works with the advocates, partners, and jurisdictions to ensure equal COVID-19 vaccination access for people with disabilities. Dr. Wiggins has a PhD in developmental psychology, a master's in developmental psychology, and a master in social service sciences in applied clinical psychology. She has 20 years of experience with disability assessment and has authored over 100 publications and presentations. She researches and lectures on a variety of topics, including the surveillance, epidemiology, and early detection of developmental and other disabilities. It's so great to have you here, Dr. Wiggins, and I look forward to your presentation. Thanks.
Thank you, Barry, and thanks to the North American SCI Consortium for inviting me here today. Thanks to everyone on the call for the work that you do every day to ensure equitable vaccination access for people with spinal cord injuries and other disabilities. So as Barry mentioned, my name is Lisa Wiggins. I am currently deployed as the Disability Unit Lead on CDC's Vaccine Task Force. And I am excited to talk today and to share information about COVID-19 vaccines and their safety, some notes about vaccine confidence and vaccine uptake, and then CDC resources on COVID-19 vaccination for people with disabilities. Next slide, please. And next slide. So as of yesterday, 8 p.m., almost 30 million people had tested positive for COVID-19, and there were more than 500,040 deaths. Actually, this should say 300 million people. I'm sorry for that typo. 50 million people have been fully vaccinated. So vaccines work with your body's natural defenses, so your body will be ready to fight and have immunity if you get the virus. And vaccination is the most critical tool in bringing this unprecedented pandemic to an end. Next slide, please. So in the 1 year since the COVID-19 infection was first identified, there have been 3 vaccines that have been developed and received emergency use authorization in the United States. An emergency use authorization is given by the FDA, and it facilitates availability of a product during a declared emergency. These vaccines are held to the exact same safety standards as any other routine vaccination or FDA-approved product. And there is a robust system in place for monitoring vaccine safety. So the 3 vaccines that are currently in use are Pfizer, which is 2 doses given at least 21 days apart. And the Pfizer vaccine is for people ages 16 and older. Moderna, also 2 doses, but given at least 28 days apart. And the Moderna vaccine is appropriate for people ages 18 and older. And then we have the Johnson & Johnson vaccine, which is a 1-dose vaccine that received emergency use authorization on February 27th. And it is appropriate for people who are 18 years of age and older. Next slide, please. Okay, so it is important to get a second dose of the Moderna and the Pfizer vaccines in order to get the full effectiveness. Getting a COVID-19 vaccine is free. You may be charged an administration fee, and that fee can be waived under an HHS program. And information about the vaccine sites in your jurisdiction can be discovered by calling your state and local health departments and checking their websites. Okay. So some people do report side effects. The most common side effects are those that are also relevant to flu shot. So in the arm where you get the shot, you may experience pain or redness or swelling at the injection site. And throughout the rest of your body, you may feel tired or have a headache, experience muscle pain, chills, fever, nausea. And for most people, these side effects only last about 1 or 2 days. Okay, next slide. So all people who receive a COVID-19 vaccine are encouraged to sign up for VSafe, and that's CDC's vaccination health tracker. Any adverse event is reported to the VAERS system, which is the adverse event reporting system, and that is how we monitor vaccine safety. Next slide. So partners and jurisdictions can leverage relationships with existing systems to address vaccine hesitancy. We have held several listening sessions with jurisdictions and also sent surveys to understand how they are addressing vaccine hesitancy within their communities. And some of the existing systems that they have leveraged are community organizations, asking organizations that already provide services within the community to serve as vaccine ambassadors, hosting town halls, engaging faith-based leaders, healthcare providers, and healthcare systems, especially providing healthcare providers with accessible resources that will encourage dialogue with their patients about COVID-19 vaccination. Peer-to-peer messages are also important. It's important for people to see individuals that look like them and that have similar experiences, who have received the vaccination and speak positively about their experience. And then also vaccine ambassadors who are trusted members within the community. I will say that from our listening sessions, we did learn that there were some common fears associated with COVID-19 vaccination. And it's important to address those fears and any other type of misinformation up front. So the fears, of course, revolved around potential side effects, long-term consequences, and so forth. And also general mistrust with the medical establishment and with the federal vaccine approval process. Vaccine confidence messages are being created by CDC, and their partners, including the National Association of Councils on Developmental Disabilities and the Administration for Community Living. Okay, next slide. And next slide. So within the CDC Vaccine Task Force, we have the Disproportionately Affected Adults Population Team. We call it the DAP team. And the goal of the DAP team is to ensure equitable vaccination among everyone, but especially among disproportionately affected adult populations. And people with disabilities are recognized as one of those populations. Next slide. So the DAP Disability Subteam has created a framework that includes 5 different goals that we are seeking to achieve, and we align each of our activities to address one of these goals. So our goals are to create and disseminate messages in a variety of different accessible formats, to raise awareness about the unique challenges that people with disabilities face in terms of receiving a COVID-19 vaccine, to address vaccine hesitancy within the disability community, especially among direct service providers who we learned in our listening sessions are especially hesitant, to include people with disabilities in emergency preparedness response efforts, and then also to identify and remove barriers to equal vaccination access. Okay, next slide. CDC has developed a host of different resources for the disability community. We do have a toolkit for people with disabilities that is posted on our website. We attempt to post anything that is related to individuals with disabilities and COVID-19 in that one place so that it's easy to find and navigate. And that website does comply with 508 standards. So some of the specific COVID-19 vaccine specific resources that we have developed are 3 different web pages. One of them is vaccine considerations for people with disabilities and their caregivers. 2 others are guidance for vaccinating older adults and people with disabilities. One is geared toward jurisdictions and one is geared toward vaccination sites and providers. And we do note the ADA requirement for site accessibility on the webpage that is geared toward vaccination sites and providers. We also provide several different tips for vaccination sites to ensure vaccination of people with disabilities. We also have a webpage for guidance for vaccinating people who are homebound or isolated. And we have a link to American Sign Language videos. And just, so you know, we work very hard to ensure that all information about COVID is accessible for people with disabilities. Okay. So these are some available COVID-19 resources that have been developed outside of CDC. There are resources for people who have limited English proficiency and resources for folks who speak in American Sign Language, and also some resources in easy to read formats. We have partnered, or the CDC Foundation has partnered with the Georgia Institute of Technology, their Center for Inclusive Designs, to translate COVID-19 vaccine specific resources into accessible formats. And you can certainly go to their website and see which formats are available. And then we have an ongoing repository of accessible vaccine information that we're going to share with the public. Okay, next slide. So again, thank you very much for inviting me today. It's been a pleasure, and I'm happy to take any questions.
Well, thank you, Dr. Wiggins, and thank you all of our speakers. That was a lot of information, and we do have some time to field some questions, but I did want to ask a question first. Maybe I can direct this at first to you, Dr. Wiggins. One of the concerns that we have in our community is that many people with spinal cord injuries depend on care. And so they lack that independence. And that's really where probably our higher risk is that throughout this pandemic, we've not necessarily had the opportunity to avoid having people come in and provide care. In fact, that's been a problem of even getting care, but that's another story. But you touched on something in your presentation, and I'm hearing this over and over again, that there seems to be a reluctance of caregivers and medical practitioners, even in the hospital setting, not getting the vaccine. Maybe you can speak to that and help us understand why, and if there's something that we as a community groups and organizations can do to help facilitate that. If you could let us know.
Yeah, absolutely. So again, we have learned a lot from jurisdictions that we've met with in terms of our listening sessions. And there have been a variety of different reasons that direct service providers report in terms of their hesitancy. And many of those reasons are the same as what you would expect or what is reported from the general population. So general mistrust with the medical establishment, fear of immediate side effects and long-term side effects. We have noted that direct service providers who are people of color are especially hesitant, and believe that, directly addressing the past research abuses within the community is important to recognize, as well as to disseminate information about safety, efficacy, and how the FDA approves their products for emergency use authorization. Some of the jurisdictions that we met with did interview some of their provider organizations who were doing well in terms of vaccinating their service providers, and reported some success stories. And some of those are having town halls where trusted members of the community can come in and speak to the service providers, having vaccine ambassadors within facilities who can talk to their peers and their colleagues about their vaccination experience. One jurisdiction in particular said it really comes from the top, and that the facilities that were doing very well in terms of vaccinating their providers were able to have leaders that would do things such as write personal letters to their staff, post pictures of them getting vaccinated, and share their excitement about the vaccination. And so it really is a multi-pronged effort to where you are learning strategies of success and trying to implement those strategies, adapt them into your community, and then also directly addressing the fears and the myths.
Thanks. I wondered, Linda or Dr. Milligan, did you want to comment on that question?
Yeah, I would totally agree. I mean, we are sort of seeing that a little bit. You mentioned sort of ethnic communities. That's been an issue because I found it, like, and rightly so, oftentimes the medical community has been unjustly wrong to them and this sort of thing. There's often some history there. So in our long-term care setting, for example, which often does have a high rate of minority workers there, there was some hesitancy. Definitely, we've seen some really good uptake with, as what Dr. Wiggins said, showing some leadership. So actually the physicians like us going to get the vaccine with staff and demonstrating that after has been really valuable. The one long-term care center that I work at has made up T-shirts to say that I'm vaccinated. And if you go in as a physician, you wear that, it sparks some conversation that you can start breaking down some barriers. It's challenging though, because I think it has to be done carefully, and it has to be done thoughtfully and respectfully when we talk to people about vaccination. We can't try to force it on them. And so I think it has to be a gentle approach. They have to hear it from things that resonate with them.
Understood. We have a couple of questions coming in, and actually these have been relayed from Heather. Heather, thanks for your questions. These are from her clients, that people with spinal cord injuries that she's dealing with. And I think the first question is there any studies that on the issues with regards to giving vaccine to individuals with autoimmune diseases and the worry of impact of the vaccines on people with autoimmune disease? And I'm putting this out to all three of you.
So we do know that individuals with autoimmune disease were eligible for clinical trials, but we do not know how many specifically were actually included in clinical trials. We do know that side effects were similar across populations. And again, we are tracking vaccine safety and any adverse events through our VSafe and our VAERS system. So it is something that we will be able to track moving forward.
Okay.
Yeah, I know from a practical approach, Barry, like when we screen people doing the actual immunization, there's very few things you cannot give this immunization for. And the things would really be if you've had a serious reaction to a previous mRNA vaccine, which nobody's really had, a serious vaccination to a prior dose of the COVID vaccine, if you received an immunization in the past 2 weeks, and if you're unwell, you know, maybe you have COVID symptoms, and if you're not of age. Other than that, there's very few things that really disqualify people from getting this. And that's what's made it confusing, rightfully so, because they've wanted to be transparent with how this stuff is developed, but the transparency has created some confusion, right? So it's just that they haven't been able to say that immunocompromised people, you know, what would happen. But many of the societies like rheumatological and cancer societies across North America have come out to support it. So if you go to their websites, they'll often say that we support giving this immunization. We've given it to tons of people. And just lastly, the rate of serious adverse effects in Canada with Pfizer and Moderna are like 0.009%. Like it's low.
That's very low. Yeah. And I just should mention that there is a fact sheet, Jamie, you provided, Dr. Milligan, you provided this to me. We're going to post on our site that really walks through a lot of these type of questions with regards to the various vaccines that are available. We have all four. I know the US is probably on the verge of approving AstraZeneca, and in Canada, we have the all four going now. So this is a great sheet. It looks at vaccines at a glance, and we'll post that on our site. And Jess, if you could right now, just put up on the chat group our link to our site so people can go to that after this. Now, we should remind everybody that you will all receive a link to this archive website of this production, along with links to our site providing information on COVID-19. So I do have two questions here. I'm going to read from Krista Adamson. She asked, is there a universal policy about allowing caregivers into vaccination sites? My son went with me just in case I needed help, but I'll forget to ask if this is okay at every site. I've been asked this. Okay, so the idea of a person accompanying someone there. So maybe I'll put this to you, Linda, or to you, Dr. Wiggins, on terms of accessibility. What's your answer to that?
Yeah, so this is Linda. I'll take it and then I'll turn it over to Dr. Wiggins to fill in anything I forget. So across the United States, there is not a universal policy. And that's, you know, one of the things that I mentioned is a challenge for us, is that states have had different policies on how they roll out, prioritize, and sort of how they accommodate caregivers and other individuals. So I think Dr. Wiggins can speak to the work of the vaccine task force and the work that they're doing in terms of promoting kind of more universal policies. And that's something that certainly FEMA does in the Office of Disability Integration and Coordination when we're on the ground, or, you know, we're working through the NRCC. We can make recommendations on, you know, that this would be a best practice or a better practice, right? But, you know, across the United States, because not all vaccine centers are federally supported, that also creates, you know, another sort of interesting wrinkle for us. As a best practice, certainly, you know, we would say that having caregivers and people with disabilities or older individuals allowed to be vaccinated or accompany that individual certainly makes sense. And Dr. Wiggins, do you want to supplement what I had to say?
Yeah, absolutely. And I would just remind everybody of the American with Disabilities Act and the requirement for vaccination sites to provide reasonable accommodations for people who may need those accommodations. So if anyone requires that a caregiver or a service animal or anyone else accompany them to a vaccination appointment, that they should be allowed to accompany them if that's an accommodation that they need. Otherwise, I would certainly suggest to talk with the vaccination site beforehand to let them know about the accommodations that you will need so that they can prepare for that. And we do have, again, some of the web content available that, that encourages vaccination sites to consider these different accommodations for people with disabilities.
And there was a second part to this question, which I think we've been dealing with this throughout in all jurisdictions of North America. And it deals with the issue of what if someone with an SCI is hospitalized, and has FEMA or CDC thought about changing restrictions for a family member to be with a patient, because it's been very trying for especially somebody needing assistance like ourselves in our community, and being on their own and told they can't have someone with them. Now, I know there's a myriad of exceptions that we've heard about anecdotally, but I just wonder if CDC or FEMA has taken a kind of a more universal look at how we could accommodate people like this.
So this is Linda again, and I'll start and turn it back to Dr. Wiggins again. So that is one of the things that we looked at from the very beginning of this, and the need for people, either if they had a caregiver or a PA or somebody who needed a sign language interpreter with them or anything like that. And we saw very early on, for example, Rush Hospital in Chicago instituted their own policy, change, allowing for an individual to have with disabilities to have someone accompany them. So again, when we look at what we would present as a best practice, FEMA would, suggest that that is a best practice. And I think Dr. Wiggins may want to supplement and speak to the issue of, again, providing an accommodation, right? So it's really an issue of accommodating the needs of an individual with a disability by modifying that policy.
Yeah, absolutely. I agree that it is an issue of accommodation. Also, CDC did release its new guidelines for people who have been vaccinated on March the 8th. And according to those guidelines, people who have been fully vaccinated can visit with unvaccinated people from a single household indoors without wearing a mask or physical distancing. So unless one of those people is at increased risk for COVID. So of course, other mitigation strategies are still needed by people who are fully vaccinated. So remember to wear your mask and wash your hands, stay 6 feet away in general.
Okay. Well, unfortunately, time is our enemy today. And though we've gone 5 minutes over, we could probably do another hour of this. And I really do appreciate your help. I just wanted to really, on behalf of the North American SCI Consortium and our executive, thank you, the guest speakers, for coming out today. Now, this isn't over. We will be, again, like I said, hosting. This will be on our website, and the contact information that we need to, if any questions come from us, we'd be glad to share that with our speakers if that's okay with you, and we can feel that back. And once again, we are a connector. We are actively working with United Spinal, PVA, their chapters, and the SCI branches throughout Canada. So we like to urge anybody that has these type of questions, we can connect you if we can, because these great organizations on the ground are doing, I think my understanding is too, that they are some of the organizations that are helping in the communities in helping getting distribution and educating the population on the vaccine, if I'm not mistaken. And if they're not, well, they should be. So I'm just putting that out there today. And so on behalf of NASCIC, I'd like to thank everybody for joining us today. And as our webinar, our next webinar will be in 3 months, sorry. So stay tuned. You'll all be made note of that. And we invite any comments, any critique. That's okay. We're big people. And if anything you think you need to hear with our community, we'd be glad to see if we can bring that information to you. So take care, everybody. Be healthy and be well. And thanks again for joining us today.